Hello, and welcome to Women in Business, where we interview entrepreneurs and senior managers and show you the strengths, successes, obstacles, and roadblocks women experience in business. Since I believe every person in business needs to be visible, I'd like to invite you to watch www.sob6, that's the number 6, tips.com, which will give you some valuable information should you get the call to be on radio or TV, which I think is extremely important. If you'd like to contact me personally, drop me a line at Gail Carson, that's Gayle, Gail Carson 13 at gmail.com, or go to my website, www.spunkyoldbroad.com, and sign up for my weekly newsletter.
Hi, everybody. I want you to welcome today's guest, who is Dr. DeRosa. She is a dynamic professional who is on a mission to change the face of women's health and wellness. She has more than 25 years of experience in the medical field, both on the pharmaceutical side and in clinical practice, and is an internationally recognized authority on women's hormonal health. She understands the range of health issues women face and is enthusiastic about educating patients on the realities of menopause and the risk factors of hormonal health imbalances. Welcome to the show, Dr. DeRosa. How are you today?
I am wonderful, Dr. Carson, and it's just such a delight to be here. And just as a point of reference, a lot of my patients actually call me Dr. Hot Flash, so to meet the spunky old broad.
I love that, Dr. Hot Flash.
We would get along famously.
You know, it's funny. When I was going through menopause, I guess I did have hot flashes, but I didn't have the ups and downs of emotion that most women have. I was on stage all the time, and I was sweating, and people would come up to me afterwards to ask me questions or to have me autograph one of my books or something like that. And the sweat was just pouring down my face, and I thought to myself, how embarrassing. But thank goodness those days are over, So,
well, I'm glad you went through it more easily without the emotional liability, but that's usually a testament to just women being strong and really stoic.
Well, I know you deal a lot with hormones and so forth, and I want you to talk about the importance of custom tailoring hormone treatments instead of using a one-size-fits-all approach. I have to tell you, I've always been kind of scared about hormones because you hear so many horrible stories, and yet you have people who are saying, if I didn't have this hormone, I wouldn't survive. So tell us a little bit about what goes into all of this.
Yeah, so I think you bring up one of the most important points is that there's still so much fear surrounding hormonal therapies, and it really started about 20 years ago when the Women's Health Initiative came out with a bunch of research that really scared the living daylights out of a lot of women, throwing out numbers like 24% of women are going to get breast cancer when they're on Primpro, which is this god-awful synthetic estrogen and progestin that we don't even use anymore. But they purposefully use tactics to try to scare women to promote their agendas versus really giving them true information. And you can manipulate statistics and data to serve that need. So, for instance, when you think of 24%, you're thinking 1 in 4 women is going to get breast cancer. When you actually looked at the absolute numbers, it was actually only 8 more out of 10,000. So that's much less scarier than thinking 24%. And a lot of the data that came out initially has been rebuked over the last 20 years, but there's this hold on that women are still afraid, and even doctors who don't specialize in this area are still holding on to this old dogmatic conventional wisdom that's not even true. And when you start to look at what we call bioidentical therapies, they're actually very, very safe for women. And in fact, when you start to talk about women's most abundant hormone, it's actually not estrogen, it's testosterone in our reproductive life. And it's actually breast protective. And there's all this data out there that's just really alarmingly false that women are holding on to, and folks like yourselves are afraid of hormones when they really shouldn't be. We used to use testosterone to treat breast cancers. It actually shows reductions in breast cancer in patients. And bioidentical estrogens in women who are low-risk patients are not harmful to women. And in fact, they're very, very helpful. And when we look at risks for breast cancer, it's actually being overweight, it's actually being inactive. There's all these other factors that even having a college degree confers more risks than any of the worst estrogens do for women. So that's kind of the first thing that I always address, is that we're scared of something that we shouldn't be. And women are willing to take pharmaceutical agents to control symptoms for sleep, for depression, for anxiety, for cholesterol that comes from hormone deficiencies. And we take those medications all the time with no fear or concern about them, and they confer much, much more risk.
You know, it's interesting you bring up all these factors, because I'm not sure if you're aware, I'm going through now my 4th case of breast cancer. I mean, I've been dealing with this for over 30 years, and I never had any of those risk factors. And yet, you know, now it's probably worse than it's ever been, and I'm on all these new medications. But it's interesting to see how different approaches work for different kinds of people. Now, you say that Big Pharma is lobbying against bioidentical hormone replacement therapy. Why is that?
Well, so whenever you start to think about these things, you always have to follow the money, power, and politics. And I worked at a big pharmaceutical company, Procter & Gamble, back in the day for 10 years, and they do wonderful things. But there's a problem when you start to talk about making people sick on the backs. I mean, they want us to be sick so that a lot of folks can sell their drugs. And when you start to think about this, so think about for a second a bioidentical hormone. So when we replace hormones for women, we really first need the ability to make it unique to each individual woman, because what's going to work for me may not work for you. And there needs to be different ratios of estrogens and with their progesterone or their testosterone levels, and we're all uniquely different. But when you put out a drug onto the market, it's built for the masses. So it's one dose and one ratio. It's a one-size-fits-all approach that is likely not going to work for every single person. And there may be allergies that we have to deal with. There may be dosing issues that we have to deal with. We may want one hormone and not another, and it can't meet that need. And here's what's even most alarming in the hormonal space is men have over 31 drugs for testosterone and erectile dysfunction approved by the FDA. Women have 0 testosterone products approved by the FDA. We have no means of getting a testosterone commercially available product, and as I alluded to, it's actually our most abundant hormone, which leads, when deficient, the mood disorders, the insulin resistance, which leads to diabetes, and the cardiovascular risk with a weight gain, fibromyalgia type symptoms. I mean, we get labeled fibromyalgic all the time, and it's most likely testosterone deficiency. So we can't get our drugs commercially available, so we rely on compounds. So to your direct question, though, why are they trying to shut this down? Well, first and foremost, if I have a bioidentical hormone, say 17-beta-estradiol, which is what our ovary makes, it's kind of like a generic of our hormones. It's what God gave us. It's what we make. And for a pharmaceutical company to be able to bring 17-beta-estradiol to the market, it wouldn't do that and spend millions and millions of dollars unless it could patent protect it. So in order to make a patent on it, you have to do something unique to that molecule, either put it in a unique delivery mechanism, such as a patch or some form that's different, or you have to change the structure of the molecule to make it special, which then it loses its bioidentical nature. So these bioidentical hormones, unless they have something unique, they're not going to bring to market to protect. But with that said, they've got all these synthetic variants out there that they can patent protect and make a ton of money on. But if these compounding pharmacies are getting a bite of that pie and taking away some of their potential profits, they don't want to see that happen. And the other thing, when we replace hormones with women, we alleviate, because we treat every day with medications, pharmaceutical agents, all the symptoms of hormone deficiency. If you don't sleep, you get a sleep med. If you get depressed, you get an antidepressant. If you start having muscle aches and pains, they're going to put you on painkillers. And the list goes on and on and on. But if I give you one hormone, I can control all of those things. And I can give it into in a compounding fashion, which is going to be cheaper and cuts out the pharmaceutical industry. So there's a
Wow.
lot of money made on the backs of our health.
So you talked about the gender gap in healthcare. Is there anything on the horizon that's going to change that?
Oh my gosh, that's such a loaded question. So unfortunately, the gender gap, it's been present for decades, and it doesn't appear to be getting better. And I saw it early in my career getting a little bit better, but it seemed to have stalled, and it seems to be getting worse. Because it just never seems to amaze me that first and foremost, the lion's share of the research that's done on drugs is done on men. And then they extrapolating it, thinking that it's going to work for women and that we're just little men. And it's not true. It's physiologically and medically inappropriate to do that. Also because there's this very large lack of understanding about female hormones where they don't understand the role of testosterone in women. So they discount our need for it when actually it's our most important hormone because it's the one that prevents the insulin resistance, diabetes, and heart disease. And unfortunately, nobody's bringing to market those types of products. As I said, there's zero FDA approved commercially available products. But men, God forbid, you stand in front of one of their erection problems, and they all of a sudden get 1 million drugs approved for them, and they rush them through the FDA and don't give. Because when you look at, say, Cialis or Viagra, a man can die from taking one of those, but they approved it with very little research. But there was a massive trial for testosterone for women, and they didn't approve the drug because, God forbid, we got some chin hair. So it's this huge gender bias, and it's horrible, and we're discounted. And when it's interesting, when men get testosterone deficiency symptoms, they give them testosterone, what they need. When we get it, we get psych drugs. So it's alarming that we're discounted and that we're constantly being blunted in our mood when actually we just need our hormones. And we've come to accept it.
So why are compounded hormone treatments so important, not only in women's health, but also in the LGBTQ community?
Well, when you look at it, again, as I keep alluding to over and over again, if we don't have compounded hormones, women have zero ability to get their testosterone products, which we need to control our mood, our energy, to prevent breast cancers, to prevent the diabetes and cardiovascular disease and all those things. So we have no other way of getting it. And when you start to also look at the LGBTQ community or even transgendered who are trying to hormonally switch their milieu, the only way to be able to do something that's customizable and available for them is through compounding. You eliminate compounds, those two patient populations, women and the ones who are the LGBTQ community, transgender, they are definitely SOL. They have no other option in the commercially available space and will be harmed. I mean, when we start thinking about some of the things that are going on, we will have to continue to suffer and not get what we need. And women continue to do that time and time again now. But we're given anxiety meds, we're given psych meds, we're constantly told we're depressed, and we're being completely blunted as a society.
So, you say that there's a lack of transparency in the FDA, and yet most of us look to the FDA as the got-all and answer-all to everything. So how does this lack of transparency put us at risk other than the things that you've just already talked about?
Yeah, well, and the FDA, and again, I don't want to suggest that the FDA doesn't have a role and a positive role. They're there to protect and also to try to prevent bad things from occurring in the medical space and the drugs and the different things that we're utilizing. But they're not supposed to be, and legally supposed to be, acting in a role as the clinician or the provider taking care of the patient. And they're trying to overstep their bounds, in particular in this space, and telling doctors how they should be able to treat patients when we've been treating with hormones and various other things safely for years. And there's been no safety signal whatsoever to suggest that hormones are, that when done properly, or bioidentically, that there's problems for women and or men in certain areas. And unfortunately, they're coming after them saying that, well, there's no clinical utility, meaning, well, women shouldn't really need it anyways, which is medically inappropriate and incorrect. So they're trying to step into the role of being a clinician and not really dealing this from a safety standpoint because they've not been able to prove the safety issue. But there has to be, again, when you start to talk about money, power, and politics, you're talking strictly big money, the bulk of the funding that comes to the FDA comes from pharmaceutical agencies when they pay them significant dollars in fees. And you can't tell me that there's not conflict of interest when the FDA is getting a lot of money from the pharmaceutical agencies. And there's a lot of lobbyists and various other things that are working on Big Pharma's behalf. I mean, it's a behemoth when it comes to lobbying and the dollars that they have available to them compared to some of the smaller compounding and mom and pop shops. And we're getting run over.
So I guess the question for me is, what can a doctor do? In other words, suppose that, a doctor thinks he or she knows exactly what should be prescribed or what should be done, but they're unable to do it. So how does a doctor operate in those circumstances?
Well, I mean, there's several things. If we look at first off, we need to have a voice. And the good news is there's a lot more people are becoming aware that a lot of these things are occurring. So coalitions are developing. Folks like myself who practice medicine in this space, we're banding together and we're trying to get some lobbying power. We're trying to use legal avenues to show the conflicts of interest and the various things legally to show what's going on behind the scenes that are driving this that potentially can hurt. So there's dollars being spent, but unfortunately it's going to be a big fight. But I think patients and clinicians around the country need to start screaming and yelling to their representatives in Congress, saying that this is a huge problem, and physicians shouldn't have the right of how they believe they should be able to prescribe taken away from them, getting in the middle of that patient-doctor relationship. And women need to be very loud and clear that why do men get 31 drugs and we get 0 when it comes to testosterone? Or why do they always seem to get their hormonal needs met when women, all we get are these synthetic preparations overall that we're supposed to be one size fits all, and it's not appropriate. The problem
and
is
what has the answer been?
Pardon me?
But what has the answer been? What has the answer been when you've asked those questions? What has the answer been?
They keep saying that it's about safety and women are at risk, and they keep saying that, but there's no. They say that without having the data to support that, and that's the alarming thing. When I presented to the FDA committee, when they were looking at this, it was like they almost had made up their mind ahead of the thing that it was like the deck was already stacked against us. And our group submitted hundreds and hundreds to thousands of articles supporting the safety. And in their report that came out, it had 13 articles, about 8 of which weren't even directly related to hormones. It was related to a supplement, DHEA. So they hand-selected and cherry-picked the data. So it's unfortunately, we just have to continue to scream and fight legally and lobby and make people aware so that they can scream and yell. Because if we're not careful and we get complacent, we could be at risk of losing our ability to have the hormones we need.
So when a woman is going through menopause, and some people have terrible, terrible symptoms going through premenopause, what is your suggestion? What is it that a woman can do?
So I went through menopause at 35, and I started having symptoms in my medical school and residency. So I understand what my women are facing. And there's this misnomer that people think, menopause, when you lose your ovarian function, that's when everything starts. Well, as you alluded to, perimenopause, which is usually about the decade before the ovaries retire, is when really symptoms start to occur. And that's where they start to develop the hot flashes, night sweats, mood swings, insomnia, new onset mood disorders, all these various symptoms. And first off, it's about recognizing that this isn't normal and that your voice should be heard. And don't be discounted, and don't be labeled fibromyalgic, depressed, or anything. Women know their bodies. If they know something's not right, they need to start asking further questions. So find clinicians who specialize in hormone deficiencies and not just rely on your OB-GYN or traditional PCPs, because a lot of them don't have the proper education. They're well-intended, but not properly informed. So go to those clinicians so that you can get the proper blood work drawn, you can have your proper symptoms assessed, and then if it's appropriate, get on hormone therapies that can help you transition through that. And this is not all about just treating hot flashes and night sweats and symptoms. That when we lose our hormones, we start to lose our bone, our arteries start to harden and lead to high blood pressure. We start to get cholesterol abnormalities. We start to develop insulin resistance. This is also about preventing chronic illness. So it's not just about symptom relief. So it's serious business. And I mean, we joke about it all the time about hot flashes, but from a medical standpoint, there's a lot of things and consequences that can occur. So go to the folks who specialize this and demand better from our medical profession.
So that brings me to the question of, you hear more and more older, at least you read about it with celebrities, but you hear about more and more older celebrities having kids and at 46 and 48 and sometimes even 50. How are they doing that? When I remember they used to say anything past 35 is too much.
Well, and actually, when women have babies over the age of 35, risks of complications like Down syndrome or genetic abnormalities or even problems with the mother and her health go up tremendously. So Mother Nature never intended us to have babies well in our 40s, 50s, and 60s. I mean, biologically, from a pure health standpoint, Mother Nature wants us to have babies when we're at our most youthful and vibrant, and then also to be there for when the child is growing up. So, but as you suggested, we're living longer. Women are delaying childbirth because of their careers or various choices. But in those cases, most often they're having to get into really expensive IVF treatments, and a lot of these folks may be even using surrogates or saving eggs. And you hear now with a lot of young folks that because they're delaying their careers, they're freezing eggs and various other things that can then be fertilized down the road and then implanted. But we're basically doing an end run around Mother Nature.
Well, let me ask you something, because we're coming to the end of our show, Dr. DeRosa, and I wanted to have people know, how can they reach you? What's the best place to go to find out information about you and what you do? So how can people reach you?
So I have a very simple website, drhotflash.com, so drhotflash, HOTFLASH.com. So if you go to that page, there's lots of education about various things around hormones. That we have a tab for medical professionals who want to become trained in that area or want to understand more about it, and then also for patients who may want to seek treatment. So there's all kinds of wonderful information on that website that patients can get information about. And I hope people will take the time and energy to learn what the real truths are about hormones, because we shouldn't live in fear. And in fact, that fear that's been propagated by the media that incorrectly is irreparably harming women's health. I mean, it's already been 2 decades and we still haven't recovered. And I don't see this getting markedly better for at least another decade. That's a long, long time to have women being improperly cared for. And we have got to do better.
Well, I strongly suggest that everybody who can go to your website, find out the information that you talk about. And what would you say if you feel that someone is not getting the information they need from their doctor? Should they change doctors? Should they go somewhere else? Is there a website that they can go to that would give them more information?
So what's interesting is, first thing I want to always tell women is trust yourself, trust your bodies. If you know something's wrong, don't accept what's being told. Continue to seek until you feel comfortable. And there are many doctors who may tell you that this is all in your head, and you need to trust yourself and trust your instincts first and foremost. So if you do go to my website, drhotflash.com, there's actually, you can purchase a book that I wrote called The Women's Hormonal Health Survival Guide, How to Prevent Your Doctor from Slowly Killing You. I know it's a little, the title can be a little egregious, but it was meant to really capture the attention of folks, knowing that doctors may be well-intended, but they may not have the right information, and you need to arm yourself with information. And in that book, it goes through about all the different hormonal stuff, but at the very back of it, there's checklists about hormone deficiencies, which ones you could be suffering, but also what are the questions you should be asking your doctors, and what are the questions that are alarm symptoms or red flags that you need to be running out the office and going somewhere else, but also how to find resources and get to the folks that you need to see. So It's a quick read. But it has a ton of great information and resources for patients who are struggling and want to find the right place to go.
Well, Dr. DeRosa, you have certainly been a wealth of information today, and people are not going to forget your website, drhotflash.com. I love it. So thank you so much for being with us today. I'm sure everybody had a lot to learn, and a lot of success in your future endeavors to get all of this work done.
Oh, thank you. And it's been such a delight and thank you so much for having me on your program and getting the information out to your listeners. It's folks like you that are helping us spread the word, and I'm just so humbled and honored to have had the time with you today. So thank you.
Thank you. Bye-bye now.
Thanks for listening to Women in Business. I hope you enjoyed today's show. And if you have any suggestions as to who you'd like me to have as a guest, just email me at gailcarson13@gmail.com. Be sure to check out www.sob6tips.com. And in the meantime, go to www.spunkyoldbroad.com to see the resources I have for you.